President-elect Joe Biden has unveiled his coronavirus vaccination program as the U.S. wraps up its deadliest week since the pandemic began. The national death toll is quickly approaching 400,000. This as more than 2 million lives have been lost to the virus worldwide. And a new study from the CDC forecasts the more contagious UK variant could become the dominant strain here in the coming months. Meanwhile, U.S. vaccination efforts have stumbled this week as confusion grows over who will get vaccinated next and when. The national vaccine stockpile is also running low. New York City says it could run out of doses by next week. Mr. Biden says things will get worse before they get better, but remains confident that his administration can vaccinate 100 million people in his first 100 days in office. Danya Bacchus reports from Los Angeles.
Dodger Stadium in Los Angeles County is now one of the nation's largest vaccination sites. LA County added nearly 2,000 COVID deaths in 1 week. Health officials say 1 in every 3 people is infected with the virus. The CDC warns that the nationwide death toll is expected to rise by more than 90,000 in the next 3 weeks, up to 477,000 total U.S. deaths. With the virus surging, officials are hoping this site here at Dodger Stadium will be able to handle up to 12,000 people per day, but vaccine supply remains an issue. Officials say New York City is on pace to run out of vaccine doses next week.
That's the mathematical problem that the federal government created. We're going to make it open to 75 plus. We're going to make it open to 65 plus. And don't worry, we'll increase the supply because we're going to send you the second dose. Not true.
President-elect Joe Biden unveiled his nearly $2 trillion plan to combat the pandemic and boost the economy. It includes $400 billion to deal with COVID-19, including more money for testing, assisting schools, and vaccinations.
The vaccine rollout in the United States has been a dismal failure thus far.
Biden's plan also includes $1,400 stimulus checks. Danya Bacchus, CBS News, Los Angeles.
It took 8 months to reach 1 million global coronavirus deaths, but less than 4 to pass the more than 2 million deaths that we currently have. And while vaccines offer some glimmer of hope, efforts here in the U.S. are still lagging. Nikki Batiste has the latest.
In the rush to vaccinate, lines growing long, patients running short.
They say call at another time, we are overwhelmed.
Some in New York had appointments but were turned away.
People will die because of this failure.
Then suddenly this morning, another hospital announcing 1,500 available doses. Lines stretched around the block.
It's just absolute shame on America that this is how the rollout of this vaccine is going.
How would you describe all of it?
Terrible. You know, I hate to say this, but I think the whole thing is a mess.
Here we are, we're getting it. And it's just luck.
One problem is that states only received a fraction of the doses they were expecting. 20 million doses were promised to be administered by the end of December. Today, less than 13 million have actually been given. Then, in what appeared to be a move designed to ease the backlog, Health and Human Services Secretary Alex Azar announced this on Tuesday.
We are releasing the entire supply we have for order by states, rather than holding second doses in physical reserve.
Not true, say the governors of Oregon and Colorado.
We were lied to with plans of the administration to release reserve doses.
But Pfizer, in a statement to CBS News, says Operation Warp Speed has asked us to start shipping second doses only recently. As a result, we have on hand all the second doses of the previous shipment to the U.S.
What do you say to Americans who are just worried about getting the vaccine?
Help is coming. More vaccine doses are being made. Most Americans will start getting access to vaccines late spring into summer.
Here in New York City, vaccine supply is so low they will run out next week. Mount Sinai Hospital canceled all vaccine appointments scheduled through Tuesday. A representative told me so far they have not been told when the next shipment will arrive. Lana?
Nikki, thank you. For more, let's bring in Dr. Cioe-Peña. He is the Director of Global Health at Northwell Health. Dr. Peña, thank you for joining us. President-elect Biden outlined his coronavirus vaccination plan on Friday. It includes creating more vaccination sites, increasing supply, mobilizing additional personnel, and launching a vaccine-focused public education campaign. What do you make of this plan, and do you think it will have a major impact in turning the tide on this pandemic?
Yeah, I think it's a good plan. It's got a good strategy. I think that the coordination at the federal level is very important. It's vitally important, as we're seeing, to make sure that this happens, that we get doses in arms, that we make sure that we have the workforce ready to administer those doses, and that the patients have the disposition that they want the vaccine. And so all of that is really starts at the federal level, gets carried forward by the states, and then enacted by the local health facilities. And in order for this to work successfully, all of those things need to work in unison. And so that's vitally important. And this is, I think, an important step in that direction.
As you just heard my colleague Nikki Batiste report, the national vaccination effort has been plagued by chaos and confusion this past week amid a push to speed up rollouts and the revelation that there aren't really any federal government stockpiles of vaccines to ensure sufficient supply for those required second doses. I'm wondering, Doctor, how concerned you are about having enough vaccine to meet the demand, even of the limited categories of people who are currently eligible to receive the shot.
Yeah, I mean, we knew that there was going to be a vaccine shortage. We knew that going into this. We knew that we were going to have limited production in early 2021, and then it would ramp up. The issue is that we need to have a consistent supply delivered to the states and then delivered to health facilities so that we can schedule people for these doses. When you don't know how much dose you're going to have in the next week or in the next month, it's almost impossible to plan for vaccination in an orderly fashion, which is why we're hearing a lot about this frustration and about people getting appointments canceled. We need to know when the doses are coming, how much is coming, and when we will be able to administer it in order to schedule people effectively. There was always going to be a bottleneck. I think what we need to see now, though, is good communication about how we're going to move through that bottleneck into the spring and summer when we won't have a supply issue anymore.
And I can see how that will potentially, part of what needs to happen now are people who have been promised their first dose might have to wait longer. But I guess two questions here. Are you concerned that there is actually a sufficient amount of supply right now to meet all those second doses for people who have currently received their first dose? And how effective is the vaccine if people don't receive it right at that 3-week or 4-week mark, depending on whether they're getting the Pfizer or Moderna vaccines?
Yeah, I mean, the short answer is we don't really know. The studies were done at those intervals. And so we know that when you miss a dose, the efficacy is less. They estimate about 60% efficacy with the Pfizer vaccine. I think pushing the doses to the states was a good idea. I think not reserving them and holding them in reserve for those 4 weeks from now, because 4 weeks from now, we're going to have a better supply than we have now. And so the thought, I think, is not to delay the second doses, but rather to just push all available supply, keep making more, and hopefully have less supply issues as we move into 2021.
Well, state officials are also facing questions about who should get vaccinated next. What are the biggest obstacles that states will face in the coming weeks, and what are your biggest concerns?
I mean, I think the biggest concern is once you get beyond that first phase of healthcare workers, frontline workers, that when you get into essential workers, there's a considerable portion of the population that's considered essential, and so that's going to be a big jump between phase, what we call phase 1A and phase 1C here in New York. So getting the supply to meet that demand, getting the appointments scheduled, and making sure we can keep those appointments because we'll have a reliable supply. All of these logistics are going to be really important to make sure that actually happen.
Well, the CDC predicts that the new coronavirus variant, first discovered in the UK, could become the dominant strain here in the U.S. In March. Officials warn that this could actually fuel a new surge in infections. How do we get ahead of this? And what do you think that this means in terms of a timeline for when this pandemic might actually subside?
Yeah, I mean, the important thing to remember about the new variant is that masks still work against the new variant, social distancing still works, and even with a vaccine rolled out in a orderly and good fashion, we are still going to have to maintain those precautions. It is much more infectious, and I do think that there are some concerns that it could prolong what was going to be the drop of the peak coming out of New Year's. So all of us are watching the numbers kind of worriedly. But I do think that we have to remember that the same public health measures that worked to flatten the curve in New York in March and April will also work against this new variant. And we do need to use both the vaccine and these public health measures to fight both the currently dominant variant and the potential newly dominant UK variant.
All right, Dr. Eric Cioe-Peña, thank you.
Thank you.